Okay, so now we're being recorded. All right, so guys, this is City Mattress. They have 20-something locations in New York and Florida. This is a re-enrollment. We enrolled this group last year. VB only, worksite only. Accident, critical illness, hospital indemnity, and disability is what we did last year. And this year, we're adding UL. So in order, because they have so many locations, to make it cost effective, we did group meetings this year, really primarily focused on UL. We have to hit participation, and that's the main focus. Although they can still make changes to the other stuff, and we'll go over how that's done. So you're not enrolling on a platform at all. You don't really even need a computer, but the PIR report is helpful to have with you, and the thing is like 48 pages. So that would be a reason to have the computer with you, just to look up what someone currently has. We'll go through that too. So the managers at each of the stores have signed off on the schedule, so they're supposed to be setting this up, although I would not doubt if you arrive there and nobody knows what's going on, because that's kind of typical for this client. But that's okay. You're in the store, whoever's in the store, get them together, do a group meeting. You might not be able to get them together because they might be with customers. You might have to do them one-off, but it's a 5-minute conversation, literally. So we'll go through all of that. So we have, we're delivering brochures to you, but there is an enrollment form that I just added to the training invite that you'll need to print. So just go to your local Kinko's or Staples or whatever, print them double-sided, and send me the receipt, and we'll reimburse you. This is kind of high level, everything we're going to cover, but the main focus of this enrollment, I can't stress it enough, is the universal life insurance. It's guarantee issue. It's the first time it's being offered. We have to hit participation, which is like 35 apps, which isn't much, for 230 employees, but considering we see everybody, so that's important too. I don't know if we're going to see everybody. So that being said, let's look at the flyer first. I'm just going to go through the documents that I sent you, give you some other inside information as it comes up. Christina, chime in too. So you all received the enrollment schedule. You know where you're supposed to be and when. And these were literally supposed to be 20 minutes in the store and then move on. Now that 20 minutes could be a group meeting with everybody and then hand out the forms, collect the forms and move on, or it could be individual meetings. It all depends on the location, really. There are a few dates in here because this is actually wrong. It's the 22nd, Christina, but whatever. We're only going to be there a couple days. Work with HR, new universal life insurance this year. And we'll go through the products, but this is the flyer that was distributed to all employees, actually. The universal life guarantee issue, and so on.
Scott, in New York State, you have a hospital indemnity or no?
Yes.
You do? Okay.
Yes, and it's cited in Florida. Yeah.
Ah, okay. All right, that's the rub. Okay.
Yep. So these aren't New York products, these are Florida products, so we can do that.
Okay, all right. I'll have to look them over for their differences.
Yeah, sure. So that's the flyer. I included the proposal as well that has all the details. We'll go through that too. Okay, so highlights. So these are kind of the highlights based on what Christina and I know about what's going on here. So we just kind of gave you some information. This is a nice thing to have handy with you. These are the main bullet points of this case. So universal life, new for this year, guarantee issue $150 up to $15 a week for the employee. If they purchase the minimum, they can increase during future open enrollments guarantee issue. That is a statement that I want you to say at every group meeting. Even if you get the minimum today, you can increase in the future. Just if you don't get in, though, you're not going to get guarantee issue next time. We want to kind of press them a little bit on that. It's portable at the same rate. There's a long-term care rider, which pays 4% of whatever their death benefit amount is on a monthly basis for 25 months. If they are diagnosed with the loss of 2 ADLs, activities of daily living, after a 60-day waiting period. It might be 90 days. It's in the proposal. Accidental death and dismemberment is included in this policy. It doubles the face amount if it's an accident, if the death is an accident. Accelerated death benefit pays up to 75% of the death benefit if they have a terminal illness. And we need participation. We need 35 apps. So the accident was in place last year. The PIR report will tell you who had the accident and who didn't. You can enroll this one right on the form, the enrollment form that I'll show you here in a second. So the accident plan, guarantee issue, pays on a fee schedule, $2,000 initial hospitalization, $800 a day thereafter if it's an accident. There's a whole bunch of features, but this is a summary. Outpatient physician treatment, any doctor visit outside the hospital, including a dental visit or a vision doctor visit, doesn't matter. Doesn't have to be an accident, doesn't matter. $50 per year. 1212 pre-existing condition, and it's portable. Critical illness, it's not GI for late entrance. So on the critical illness, you'll see they won't be able to enroll right there on the form. They have to give us the best time to call, and our call center will reach out to them and give them some quotes and sign them up. The rates are on the form, but we have to sign them up over the phone because they have to answer some health questions if they're a late entrant. If they got 10,000 last year, want to increase this year, okay, that's cool. That's a guarantee issue increase, but we still have to do it through the call center. The critical illness includes cancer. It includes this thing, I don't know, Karen, how familiar you are with Allstate, but it includes SUP-CI2, which means it includes 7 other illnesses besides the heart attack, stroke, and blah, blah, blah. And I'll show you the proposal on that. And then there's a second event. So if you're unlucky enough to have a second event or on any of the benefits, cancer or the critical illness benefits, it pays again. $50 wellness benefit. Now the critical illness benefit, when they say wellness, this is regarding a cancer screening, so a pap smear or PSA tests or any of those kind of things. $50. 1212 pre-X, and it's portable. Now on critical illness, I added some additional verbiage directly from the proposal because this can be confusing depending on which carrier you use, right? So one carrier says cancer, if you've ever had cancer, you're not covered. Other carriers say if you've had cancer within the last 10 years, you're not going to be covered. It all depends. So I included that exact verbiage here. I'd have this with you in case somebody says, well, I've had cancer before. Just let them read that and make their own determination. Somebody join?
Yes, Scott, it's Jose Garcia.
Hey, Jose. I'm recording this, so
okay.
I'll send that recording out to everybody too. But welcome.
Okay. Thank you. Hello, everybody.
We were just doing high-level overview of the products right here. Okay. And I know that you don't have much time, right?
Yes.
No problem. So disability, it's also not GI for late entrance. So they, on the form, if they want to look at disability, they put the best time to call, and our call center will call them. 60% up to the of the gross salary up to $5,000 a month is the maximum benefit. 0, 7 elimination, 3-month benefit period. 1212 pre-X, portable. Current insureds can also increase that one up to the GI max. There's a pregnancy benefit. Pregnancy or childbirth will be covered the same as any other covered sickness if you meet the definition of total disability, provided that your coverage has been in effect for at least 9 months. So if they're sitting with you pregnant, that pregnancy is not covered, but the next one will be. Hospital indemnity. Guarantee issue pays initial hospital confinement of $415, pays a daily benefit of $165 a day up to 6 months. And there's a whole list of benefits. So the proposal has all that. 1212 pre-X, and it's portable. So that is the summary of the plans, high level. So I'm going to go into details now. So the proposal is 21 pages, probably worth it to print this out too. The broker is Brown & Brown, by the way, Brown & Brown of Orlando. I think most employees do know Brown & Brown, and they probably know us too from last year. So this is the accident, GVAP1, and it has the rates in here. Of course, the rates are also on the form. Outpatient physician treatment, accidental death benefits. This is the entire fee schedule. Dismemberment. There's the $2,000 plus the $800 a day. Medical expenses. There's just a laundry list of benefits on this accident plan. 3 pages, actually. Physical therapy, 4 pages. So it is definitely the bestseller, always. And we had good participation in accident last year, so they may already have it, but if they didn't, they can get it now. Critical illness guarantee issued to $20,000. Now that was the original underwriting offer. So this year it is guarantee issue if they're a new hire, but otherwise you're gonna have to answer a few health questions. 2 plan options, the low and the high, $10,000 or $20,000, and you can see these are the critical illness benefits: heart attack, stroke, organ transplant, end-stage renal failure. Those all pay the full amount. And then you have bypass surgery, and waiver premium is included. This is the SUP-CI2, you know, that weird thing that Allstate says. Supplemental critical illness benefits. So you have Alzheimer's, Parkinson's, benign tumor, coma, blindness, loss of hearing, and paralysis. These are all additional covered diseases. In addition, cancer and carcinoma in situ are also included. And then second event on full wellness is $50. These are the rates. They're also on your enrollment form as well. And then definitions of what everything is, you know, what exactly is a heart attack. If they have questions, definitely good to have this with you. What are the wellness benefit things that you can have? So biopsy, blood test for triglycerides, the PSA is in here, chest X-ray, colonoscopy, whole list of things to get that benefit. Pre-X is 1212. This is the Allstate calls this SHOP. It's group hospital. It's hospital indemnity is what it is. They call it SHOP, but it's guarantee issue even this year. It's hospitalization. So this also has a long list of benefits. But basically, if they're admitted to the hospital for any reason, doesn't have to be an accident, $415, and the benefits increase for 6 years, actually. And then for every day after that, up to 180 days, they have that 165, and so on. It continues. It's the same thing for every category. So you'll see an initial benefit, or you'll see a year 1 benefit, and so on. Hospital intensive care, surgery and anesthesia, inpatient physician treatment benefit, outpatient, emergency, a long list. This is also pages of information. But the main focus on hospital indemnity is that initial benefit for being admitted to the hospital and the daily benefit. That's going to help them with that big deductible that they have. Pre-X 1212. Group disability, 07, 3-month benefit, up to $5,000 a month, 60%. There's not much to say about disability. It pays when your doctor says you can't work. and there's the rates, but you don't really need the rates. You're not going to be calculating rates. They're going to use the call center for that part. So that is the proposal. That is everything that I'm showing you is in the training invite that I sent. Okay, so let's look at the PIR for a second. So this is a policy information report. This is what's currently on the books for these employees. It's a PDF, and this is the only reason you would need a laptop, really. But so you can just click anywhere and do a Control F and type in somebody's name. I don't know if there's a Jones in there. Oh, there's a Jones Avenue. So this is Janelle Harris. So they have GVAC1, which is the accident. There's a description. And then they have this rider. So they have the accident plan. It's $3.35 per pay period. They give you per pay, they give you monthly, and they give you annual here. So anyway, you can see what people have if they ask. You don't need to do this for every single person, but if they ask, what do I have now? You can let them know. If they, okay, that's all I'm going to say about the PIR for now. Let me get to the enrollment form. So this is the enrollment form itself. So as you're having your group meeting, or if you're meeting with them individually, you hand out this form, have them fill this thing out. We need at least, at a minimum, their name and the last four of their social. Even if they say, I don't want any of this stuff, okay, I need your name and the last four of your social so we can go back into the system and waive everything for you. So you have a yes or no on these. Yes, I'm enrolling, or no, I'm not. So they would check the no's and then sign it. Or we'll get to the rest. If they are enrolling, then we need all this information, obviously. We need all the information. We need their beneficiaries' information. We need their dependent information, as it is here. New is the universal life insurance. Now, we can enroll them, and we want to enroll them in the UL right now while you're there. We've got to get that participation, right? So we have a separate form that you'll also need to print. You don't have to print 100 of them, but just print 5 probably. Where is that thing? Which is the UL rate sheet. So you don't have to do any calculating. You just ask them how old they are, and $6 a week is going to give you this, $56,000. That's all. So you go over to the enrollment form, and that's what you check, or that's what you enroll them in. Check it, put in the benefit amount, and a yes, and they're done. If they're getting dependent coverage, anytime you see a best time to contact, that means that you cannot enroll them. We've got to use the system to enroll them, and we can't really do that for a group meeting. So just take down the best time to contact them, make sure we have a phone number up here at the top, and we will call them as soon as we get this form back to us. The accident plan you can enroll in. You just choose the tier. There's the rates. This critical illness, we put the rates on here. Again, it's not going to be GI unless they're a new hire, so it's best just to handle it in the call center. So we put the best time to contact on there. But you can at least give them the price. Hospital indemnity, there's the rates. No, I'm sorry. Hey, Christina.
Yes, sir.
Are these composite rates, or are these age-banded rates here? Because you have a 35-year-old, but they should be composite.
Let me go back. Hold on one second.
Okay. So if they are composite, you would just choose the tier and hit yes, and they're enrolled. Disability, we need to run through the call center, but there's an example of how much it would cost for a 35-year-old. And then they sign it. That's pretty much it. So we don't really want them holding on to these forms, because this enrollment is on the 22nd and 23rd, and it's a 2-1 effective. So we've got to get the forms back. We've got to get them keyed into the system so we can get the data over to Allstate, so we can start the deductions etc. So, but if
Scott,
they say, well, I need to think about, sorry?
Scott, it is age band.
It is
The
age
hospital.
band. We need to put that
Yep.
in here.
Well, that's why I put a sample for a 35-year-old. Do you want all the rates? I can throw them all kind of, it's a small chart. I can throw them on there, I believe.
Okay. Yeah, let's just go ahead and do that because there's no reason not to put it there because it's easy to enroll as GI.
I will
So we'll
update
send
that while you
updated-
continue on.
Okay, we'll send an updated enrollment form later with that. So what I was saying is I don't really want them to keep the forms, but of course, if they say I need to talk this over with my spouse or whatever it might be, okay, fine. But you need to get it back to us. We hadn't even really thought that through. I don't really want them going through HR to do that. First of all, HR is in Florida and there's 20 locations or more, so it's hard for them to do that. We'll have to think about that one. I think we have a website, info@benaware.com we might use. I think we might just do that. They can scan the form, email it to me. Those emails come to me, info@benaware.com. And I'll handle it from there. But the cutoff date literally is going to be the 25th. It's going to have to be the 25th. After that, we can't take them. So they can use call center as well. If they want to put best time to contact on there, we'll call them. But that's how we're going to have to handle it. So that is the enrollment form. Those are the rates, the UL. Highlights we covered. PIR we covered. Now this is I just have the GUL brochure in your training invite, just that one, because this is the main focus. If these don't get delivered to you, if there's something that happens, they never arrive, if you could just print out, 5 of these, just so don't let them take them, just staple them and, just have them with you so people can look them over while you're talking, maybe. That would be good. Now this is a generic one. Allstate is horrible at this. This is a generic universal life brochure, and I think this is what they ordered for us. So it talks about accidental death. That's great. Accelerated death benefit. That's great. Critical illness is not part of this policy. It's not in the UL. This is not a rider that we elected. So that does not apply. Term insurance does not apply. Spouse term does not apply. Child term does not apply. We didn't do any of these. So it's almost not even worth having them, but whatever. Christina, do you know if they're custom?
Excuse me?
Do you know if the brochures that they ordered are custom?
I believe the one brochure was a custom. Give me 1 second. Which one was it? Was it the I think it might have been the accident was custom.
Okay. I mean, a brochure is nice to have, but it's just a generic brochure. And your conversation about the portability and the long-term care benefit and the accidental death benefit and the accelerated death benefit and the portability is going to be enough to close the deal. What else do I have here? I think I've covered everything. Let's take a look at the schedule. So you all have this schedule. I haven't changed anything since I sent this out to you. So it is a tight squeeze, or kind of, because these places aren't exactly next door to each other. But I did map everything out from location to location to location to see if it was feasible to get around to these places, and it is. If you are able to get whoever is in the store when you arrive, pull them over to the side. If there's 3 people or 5 people, there's not many in these stores anyway. you can see the numbers there, 3, 5, 3, 5, 3, 6. Whoever's there, have the conversation, talk to them. It'll take 5 minutes to talk about the UL. Here's these other plans too. You can do a quick and dirty on them as well. Again, main focus is UL, and you're out. Fill out the form and you're out of there. We'll probably do a call center communication after you guys are done for anybody that we missed, just to make sure people get what they want. One thing to note is that the HR guy, his name is James Weisgal, Weisgal. He's in the, where is he? He's in this Granite Sleep office, corporate office here. He's in Florida, anyway. But everybody knows James. And if anybody questions you and say, who are you with? What are you doing here? We're working with Brown & Brown, and we're working with James Weisgal. And your manager approved this meeting, or the store manager approved the meeting. One thing that James did in his communication, which was not approved by me, but he did it anyway, is he said that this is your opportunity to enroll in, change, or cancel benefits. Well, that is true, and that is technically true. If someone wants to cancel benefits, have them fill out their name and social on here, the last four of their social, and just handwrite in clearly for us what they want to cancel, and we'll take care of it through the call center. Through the system. So that was not really planned, it just happened. So if you see that, then yeah, go ahead and take their cancellation. They have to sign it, of course. But otherwise, there is no system. There's nothing to learn there. We need to get these forms back to us, obviously. So you hand them out, you collect them, you scan them back to me is the best way, probably, because we don't have much time, to mail them or anything. If you can scan them back to me, that's the best way. And then we can get them keyed into the system, get the employees called back for those that wanted a call. And so I guess at the end of each night, if you're doing multiple days, at the end of each night or in the morning, the following morning, just as soon as possible, we like to get those back. Okay, any questions about anything? No questions means that I covered everything. Of course, I'm always available if you do have questions. And that's it. So I've recorded this. I'm going to stop the recording now. And I'll send you the recording as well for future reference. And if there are no questions, that's it, guys. Thank you so much for your help, as always. I'm always available if you need me this weekend or whenever. And good luck out there, and let's go get some UL policies.
Thank you very much. Thank you. Enjoy it.
Have a great night, everyone. Bye-bye.
Thank you.